to the Friday Five here on the Agent Survival Guide podcast. If you're new here, this is our weekly list of 5 things you should know about. Essentially, an end-of-the-week news recap. And I'm your host, Sarah Ruppel. Today is the Ides of March, and I don't know about you, but I am glad that it is Friday. Very glad that we are kicking off the weekend. So thank you for listening today. Coming in at number 1 this week, registration for Ritter Insurance Marketing's inaugural Senior Market Symposium is now open. This is a brand new event that combines 2 of our annual events into one. Craig Ritter's State of the Senior Market Address and our DSNP Summit. The event kicks off at the Crown Plaza in King of Prussia, with agents hearing from leading carriers in the local DSNP market. Then, in the afternoon, we'll turn on the live stream for our keynote address with Ritter Insurance Marketing CEO Craig Ritter. Also new for this year, an insurance expo room and exclusive swag bags. It's all happening on Thursday, April 4th, and you can register to save your spot at ritterim.com/symposium. This event is a great opportunity to network with carriers, your fellow agents, and get to meet our Ritter staff in person. That URL, again, is ritterim.com/symposium. We will be linking to that registration in the episode notes, so make sure you get yourself registered and plan to attend our Senior Market Symposium. Moving on to some super quick mentions here. At number 2, Eli Lilly is teaming up with Amazon to deliver prescriptions fulfilled through Lilly Direct. The direct-to-consumer platform was launched by Lilly in January and gives patients the ability to have select prescription drugs delivered through the online pharmacy True Pill. Patients can use the service to fill prescriptions for migraine, diabetes, and obesity drugs. Now that Amazon has been added as a partner, and depending on certain factors, including insurance coverage, Lilly Direct Pharmacy Solutions prescriptions will be delivered by either TruePill or Amazon. Number 3, and another short mention here. If you've been frustrated by needing 2 different apps for Microsoft Teams, one for personal use and the other for business, Microsoft has heard you loud and clear. In the latest Windows 11 build, specifically Windows 11 24H2, the personal and business versions of the apps will be consolidated. Similar to other apps, you'll be able to click on your profile picture to switch between accounts. And when I say that Microsoft has heard users loud and clear, this feature actually came about because of feedback from users saying that they'd like a single app experience rather than navigating between the 2 versions. Number 4. Just in case you haven't heard, on Wednesday this week, the House of Representatives voted 352 to 65 on H.R. 7521, a bill that would either ban TikTok in the United States or require ByteDance to divest the TikTok app. Now, it's important to note that just because the House has passed the bill, that doesn't mean that this bill will necessarily go anywhere. The conversation around TikTok as a national security threat has been ongoing since 2020. Also important to mention, the Protecting Americans from Foreign Adversary-Controlled Applications Act, as the bill is officially named, it still needs to make its way through the Senate. Then the legislation must go to President Biden, who has said that he would sign the bill into law should it come his way. After those things happen, ByteDance will have a 180-day window to divest TikTok to a company that is not, quote, controlled by a foreign adversary, end quote. If that does not happen within the given 180 days, it will become illegal for the app to be available for download in U.S. app stores. Little bit of ground to cover before an official TikTok ban goes into effect. We will be linking to a few different resources in the notes. I do want to point out one in particular that I found helpful. Axios published a timeline of the efforts to ban TikTok. Very helpful information in there. And I'm sure it will continue to be updated as this story unfolds. I know I will certainly be following along with this one. And that brings us to our biggest story this week at number 5. Last week, President Biden unveiled his 2025 budget during a televised State of the Union address. In it, he doubled down on quite a few healthcare reform initiatives, some that concern Medicare, others that bring Medicare-style benefits to the masses. There's quite a bit to unpack here, but let's start out with drug price negotiation. With passage of the Inflation Reduction Act in 2022, we are currently witnessing the gradual rollout of the government's ability to negotiate Medicare drug prices. For plan year 2026, there are 10 drugs on the list. That will increase to 15 drugs for each plan year 2027 and 2028. And then in 2029 and beyond, we hit the 20 drug per year threshold. In his remarks, Biden mentioned expanding negotiation to, quote, 500 drugs over the next decade, end quote. It's unclear as far as the timeline in getting to 500 drugs by 2034. With the current phased-in approach, we'd be at 160 by 2034. I did scan through the text of the budget bill, and all I could find was, quote, significantly increasing the pace of negotiation, bringing more drugs into negotiations sooner after they launch, end quote. Another Medicare mention in the budget proposal, a cost-sharing limit of $2 per high-volume generic drug prescription for Medicare beneficiaries. Medicare solvency also came up in Biden's remarks. With current levels of funding, Medicare becomes insolvent in 2031. And when I say insolvent, it does not mean that the program completely runs out of money. It just means that the program cannot pay 100% of benefits. Not a good thing, not the future we were promised. But according to a Department of Health and Human Services release, the budget extends solvency, quote, indefinitely without cutting benefits, end quote. Other reports say that solvency would be extended through 2050. In order to fund Medicare, Biden announced plans to raise taxes on Americans with income greater than $400,000 per year. That bracket currently pays 3.8% on their taxes. He would raise rates to a 5% tax. Additional methods for funding Medicare include, quote, closing loopholes in existing Medicare taxes and directing revenue from the net investment income tax into the HI trust fund as was originally intended, end quote. Also included in Biden's 2025 budget, expanding two popular benefits from the Inflation Reduction Act to commercial health insurance. First, a $2,000 per year maximum out-of-pocket spending cap on prescription drugs. Second, expanding the $35 per month cost-sharing caps on insulin. Another popular feature of the Inflation Reduction Act, the enhanced premium tax credits for marketplace coverage. Biden's budget calls for those subsidies to be made permanent. On the Medicaid front, for states that have declined expansion, the budget includes something called Medicaid-like coverage. That would open up the possibility of healthcare coverage to another 1.5 million Americans. And then for states who have expanded Medicaid, they'll be offered financial incentives to keep those expansions funded. Changes to the Children's Health Insurance Program, or CHIP for short, include eligibility from birth until the age of 6 and for 36-month periods rather than the current 12-month period. Enrollment fees and premiums for CHIP would also be prohibited. For more information on these provisions and others mentioned in Biden's 2025 budget proposal, check the links in our episode notes. We have links to press releases, fact sheets, articles, and the official budget document. Just in case you're in the mood for some light reading over the weekend. Rupel recommends. We are switching it up a little bit for this week, bringing this section back by popular demand because it's been a while since I've done one. And quite honestly, I've missed sharing these little tidbits at the end of our Friday 5 episodes. So first things first, we're going to be incorporating this segment into every Friday 5 episode moving forward. It might be earlier in the episode, it might be later in the episode, but it's a fun segment, and I think it's earned its way into one of the official Friday 5 mentions. And then the next, I have a question for our listeners, and it is a really important one. I need your feedback on this. Since the Friday 5 began, I have always numbered the mentions that I talk about here on the show. I'm not quite sure why I did that originally, possibly because of my OCD. I mean, that's part of why our episode notes are in alphabetical order, in case you've ever wondered, but that is another story. My question for you this week is, do you want me to keep calling out the numbers of the things I mention here in Friday 5 episodes, or would you rather I just move from topic to topic with fun and interesting segues, like say, meanwhile, on the other side of town? We'll be linking to that poll in our notes. We'll be mentioning it in this week's Friday 5 social posts as well. So if you see that request to go and vote, please do that. I would love your feedback, and this is something that is super easy. Just click yes, I love the numbered mentions, or no, we trust that you'll bring us 5 things every Friday. Really appreciate getting your feedback on that. I'm looking forward to hearing your answers. And if there's anything else you'd like to tell us about the show, how much you love it, what you'd like us to cover next, you can always do that by emailing us at asgpodcast@ritterim.com. That is asgpodcast@ritterim.com. Please send in your answers. We will let you know the results in next week's Friday 5 episode. That is all we've got for you in this week's episode. Thank you so much for listening today. I hope you have a great weekend. Stay healthy, stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Rupel, script editing and fact check by Tina Lamoureux, podcast design by Urban Rivera, artwork by Vivian Zhao. Follow along with us wherever you like to listen.